following views are those of the host and not those of Clear Channel Broadcasting licenses.
Have you gone to the doctor recently because of pain throughout your body for which there seems to be no relief? Introducing Dr. Anthony Pinozzo. The Dr. Pinozzo Sports and Medicine Hour will bring you a new technique to resolve painful issues throughout the body. Dr. Pinozzo has worked with over 65,000 patients over 40 years and has developed a revolutionary approach to pain treatment. His treatment allows fast and effective treatment of pain without narcotics, surgery, and physical therapy. There is no manipulation or alternative approaches. Weight bearing and the return of normal range of motion without pain is the best kept secret this man has to deliver. So, get ready to call in and ask all of your painful questions and get the answers you've been looking for. Now, here's today's edition of Dr. Pinozzo's Sports and Medicine Hour.
Good morning, everybody. I hope you're having a great Sunday. Let me introduce you to our principals. We have Dr. Anthony Pinozzo. How you doing, Doc?
Terrific.
And we got the leader of and the star of the show, Dr. Pinozzo, as well as Freddie of AMP2, who makes this possible.
How you doing, guys?
The genius behind the board. Everything good, buddy?
Everything's great.
Well, today we're going to probably try to answer some of these questions because they keep building up. But before we go in there, Doc, what would you have done to help poor Tiger Woods? Here's a guy that's struggling. His swing is off. He's compensating. He's compensating with
Hey, talking to the mic.
He's compensating with all of these new swings. What happened?
I think it's misdirected, and you always know if you're successful doing what you're doing. If you're successful,
Exactly.
if you're not, you better stop doing that.
Exactly. No, you're right.
So I think he's got to get back to a normal swing, and what we would do is analyze the swing as to pain production.
Explain what that means. So,
That means that you swing your club as hard as you can in front of the camera, and you actually tell us where the pain is, if you have any.
Right.
So the more pain you get, the less swing you have. The body will actually shut you down. Now, the PGA instructors, I don't know who they are, but I would tell you they do not have a background to do this.
Of course not.
Because you have to know anatomy and physiology. That's what I'm trying to tell people. This is a medical problem at the tee. Once you get past that, then it's the art of golf. You can use any club you want. But we know where all the pain is in the golf swing. And all you have to do, all someone has to do is swing in front of the camera. Well, we do it in front of the camera so we can reproduce it. And 10 minutes after treatment, do it again and see if and then you'll see a difference.
I mean, I've been there.
So the pain will be gone
Right.
on the second go around.
Right.
So that's how we know. Well, we know we have a large experience with of treating painful problems for other reasons. And all we did was adapt it to the golf swing. And I followed Bob Tosky around for a long time to find out what the swing was all about. Now I could actually improve your swing myself, but
How many yards could you give him?
I wouldn't do that. No, I wouldn't do that. I would take the pain out, give you a normal range of motion, normal swing like a 12-year-old. Then you could go back and hone your game. But unless you can swing that club, you can't play. I mean, if a professional seems to me like Tiger Woods hits into the rough a lot, there's something wrong here. I mean, it's not a normal swing.
He didn't make the cut?
He didn't make the cut,
Well,
and he's got a lot of pain there.
Well, he
so-
said that he hurt his back on an awkward shot that he took on one leg. Did you see the shot?
Yep. Yep.
And then he swung and twisted, and his back went out.
It doesn't go out. It's a ligament that's sprained, and you could find it easily and treat it directly.
So if he came into you, that would he would be better because you could even watch the way he was swinging. He wasn't doing the art that you always talk about.
We would actually remove all that pain before he left the office.
I know.
So all he had to do was rest up one day, then go out and play, and he'd play well. But you got to forget these golf instructors who charge a lot of money and watch your swing and then change it
Right. That's
and
what
get
they
credit
do.
for it. But that's not what to do. You don't change the swing.
Cause of pain
You take the cause of pain out
and where that pain came from.
and where it came from, and then the swing reverts to normal. So,
So-
people have a normal swing. I mean, just watch it, like I keep saying, watch a 12-year-old. That's a normal swing.
Watch Rory McIlroy. That's a normal swing.
That's a normal swing, and it gets abrogated through the years because this guy says this guy says that, you change this, you change that. I mean, don't do it. Golfers should never change their golf swing.
Yeah.
That's their signature thing.
So all you golfers out there, if you want to get in today and talk to Dr. Pinozzo, you call my hotline, which is 877-927-6969. Now, don't call at the end of the show when he can't answer your question. So all of you who are driving in your car, especially you golfers, are saying, God, I got pain in my shoulder. I hope I can make this thing.
We don't mind any question, right, Les?
No, any question you want. If you want to talk about your golf pro and why is that the one thing about Dr. Pinozzo, we don't rehearse the show. We come on, we just ask questions the way they are. And Freddie, who's been a coach for 25 or 30 years. Am I aging you, Freddie?
Yeah, you're aging me. 21 years.
21 years. I just made him a little older. Who goes to Dr. Pinozzo? And I want to tell a story, Doc. This was great. I was with one of my representatives. And I'm looking at him, and I took him to lunch, and I'm saying, how come you're not moving your right arm? Don't want to give his name. You're not moving. Oh, I heard it in basketball. Oh, it was the left arm. I'm sorry. The left arm. He said, I don't know if I heard it in basketball, blah, 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 blah. I said, let's go. He said, where are we going? I said, I'm going to take Dr. Pinozzo. He said, oh, yeah, I was going to make an appointment. I said, no, you come with me. Freddie, he was there, and he emailed me, Wes, I will recommend this guy to everybody. I'm 95% cured. Is that amazing with one visit?
What was it, his wrist?
No.
Elbow.
Elbow. Like a tennis elbow.
Well, it was quite extensive.
Yeah, wow.
I don't know. He can't remember how he heard it, but
No.
it had to be lifting up the Empire State Building or something. I don't know.
Yeah, he found the source of the pain, and when he touched it, the guy jumped up 50 feet. But 95% in one, and he called me Saturday.
How long ago did he go see the doc?
It was Friday. Was it Friday or Tuesday? What day was it? Thursday?
I think it was Thursday.
Yeah, Thursday.
Get him on the phone. I want to talk to him.
Okay. Amazing, amazing, amazing. I mean, every time, and I'm not saying this because every time I see what he does, it blows me away.
You know, what I find more disturbing
Blows me away.
Is that people will call him and they say, okay, I'm going to go see you.
And they don't.
And they don't. And what I don't understand is, would you rather live in pain, not get an opinion? I'm not saying that they have to see you.
They don't have to see him at all. Just, you know.
Well, there's a fellow here who wrote us a question about the teaching that we do, as opposed to medical school. It's very hard to do in medical school what I do in practice. First of all, the science is different than what they're teaching. So they're coming out of school not knowing a heck of a lot. That's why there's so much surgery out there. The general practitioners that come out, internists, don't know anything about musculoskeletal.
Right, that's true.
And the surgeons wrote the book on musculoskeletal stuff that I do. So when I went into practice, I've been at this 40-some years.
You don't look at Doc. You look like a young.
21 years.
Yeah, like a young 21 years, like with him. We can't age you, right, Freddie?
Can't age you.
Well, anyway, what I did was reevaluate all of the procedures we did in all of the joints and things that we treat: lower back, shoulders, knees, all of that had to have the scrutiny of the anatomy lab first. So find out what's there. How is it supposed to be used, design and function, and then create a treatment for those abnormalities that we picked up. And they'd be true abnormalities because they're not based on any whimsical system of beliefs. It's based on the anatomy. And so that's your best bet. That's how we get such good results.
Yeah.
I have a physics background, chemistry background, and that's the way I think.
No, you're in a
It's,
mathematical brain, which
It's a cause and effect. You have to be cause and effect. You have to know which is primary pain and which is a secondary pain. The pain you feel may not be the primary pain.
Right.
If you keep treating it, you're going to lose.
Right. It's amazing.
Intractable pain, they have that term. What that is an annulus that's out of sync. It's not intractable.
Explain
it's
to people
treatable.
what an annulus is.
Well, it's the surrounding ligament that holds the vertebrae together. It allows the motion, and they always talk about the slip disc. I mean, that's ridiculous. It does not slip. The disc itself is very small and does not have any life to it. So you can't say that you're giving it nutrients or anything. That's stupid. Don't believe what goes on. It's just not true. The pain that's there is just a sprain. You have to know where the sprain occurs, and it is a ligament, and it is around the bone of the vertebrae. So all you have to do is locate it and treat it. And we treat it by shot because that's the fastest way to get the medication in there where we want it. We want that pain out of there today. Right. I'm not going to do it by treating you with something for 3 weeks. No, if that's what you want, don't come and see me.
No, and if you want narcotics, don't come see you.
At all. You come and see me, you're going to get everything right then and there.
Right. So, Freddie, no narcotics. Go ahead, I'm sorry.
No narcotics.
Okay.
We're going to do a history, a clinical exam, a diagnostic testing that we do, and we're going to treat that right then and there. And it's all done in about a half hour. And people walk out of my office into the waiting room, and they're so joyful. They're telling people, "Oh, I'm feeling good." I mean, this is the way it's supposed to work.
Well, what's funny, if you remember, he was telling us he couldn't even tie his tie.
Yeah.
He had to have his wife tie it. When he came, he took his briefcase in his left hand and walked out. Oh, my God. I mean, I know everyone is probably listening and is saying it can't be.
You're talking about the guy with the elbow.
Yeah, I mean, Freddie, we always have new listeners, and Freddie, you had the same problem. You were going to all kinds of doctors and taking magnets and putting whoops in your ear.
Absolutely. But I want to change gears on the doctor. I'm gonna put up a picture. You remember this picture? If you go to Penozo.tv, you can see it.
Oh,
but do you remember who that is?
Yeah, that was a professional bodybuilder, right?
That's right. Yep. She's 50 years of age.
Yep.
Professional bodybuilder.
Right.
And Dr. Penozo worked on her shoulders so that she could lift weights, and she came in second place in competition for Florida. She was just in a car accident.
Is she coming back?
She called me because she's in very bad shape. She's going to call you this week. But just to go to show you, she's a professional bodybuilder. Her body is her living.
That's right. Yeah.
Exactly.
Okay, which is
she's
big.
a personal trainer.
That's right.
Yeah.
She's a personal trainer, and she uses her body to make a living. And you see that body. She's 52 years of age.
God, she looks great. She really does.
And she came to see you because she was having problem with her shoulders. Remember that?
All right.
We shot her for the commercial.
Right.
And she came in, and you took care of her, and she came in second place, and they mixed the younger lifters.
The mixed
That's the
things.
only reason she came in
not too
second.
smart.
That wasn't fair.
No,
No,
it wasn't fair. But to
fair.
come in second with these girls that are like 18, 19, 25,
That's right.
and 30.
And she still came in second,
That's
which was
pretty
an
darn good,
amazing
yes.
fact. But all of that was attributed because you helped her get back in the gym. She was going to retire.
Yeah, well, she had shoulders and dorsal pain, too.
That's right.
The
Yeah.
vertebrae between the shoulder blades.
That's
which
right.
You have to be really skilled to get that. I mean,
I mean, that's not easy.
I want
No.
to tell you how skilled I am if you don't know. I got to tell you because you just don't realize what it takes to do all that. And it takes a lot of insight. It takes a lot of studying. And I mean, it's very difficult, but we've been doing it now.
But the amazing thing is that's her livelihood. Unlike if you're playing sports or anything like that, but this is what she does for a living.
Her body is her living.
That's
Yeah.
right. And she couldn't make a living until she went back in, and she saw you a couple of times, right?
Right. Yeah.
But I just got that phone call from her on Friday, and I put up the picture because I think it was kind of cool.
What about her 250-pound boyfriend who hadn't been able to walk for 2 years and was gaining weight because,
that's right. Yeah,
because he couldn't get on the treadmill? Tell that story.
Well, the funny thing is, me and Linda saw him 3 weeks ago at the bank.
Oh, really?
I didn't recognize him. Doc, he lost a lot of weight.
Yeah, of course
He's rehabbed again because, he was on painkillers, and he became addicted.
Oh, sure.
Right,
Okay,
yeah.
which is another problem with drugs.
Yeah.
And he came to you, he cleaned himself out, and you fixed his foot that they wanted to amputate.
Right.
Remember that?
Oh, yeah.
He had the rods and everything
Wow.
in there. I mean, that fool looked horrendous.
And he was crying when he got off. And he said, "Oh my God,
You
I
remember him? We saw him in the parking lot, Linda.
Well, I have no
And-
idea what you're saying. She's got earphones on.
No,
her
she got
head.
earphones. And we started walking. We saw him. He went back into the gym.
Yeah.
He's dropped like 50 pounds. He's healthy again. He's not on narcotics anymore because he was an addict.
Yeah.
And your procedure gave him another lease on life.
What we're trying to do with this whole show, people, is to let people know that there is an alternative. Dr. Pedozzo doesn't want to see you go through. Look, him and I both know somebody that just went through a surgery on both of his hips. Dr. Pedozzo told him, don't do it. Let me help you. He called me and says he's in such bad pain, he's taken double doses of medication, and they cut a muscle, which I was telling you about. So now he can't walk,
I have no idea what that means.
and he doesn't know, he doesn't know when he's going to be better. And I said, I don't want to use the word. I don't want to use the words I said to him. But I mean, why not come to you and we get an opinion? That's all.
I have no idea.
I mean,
I'm not going to bite him.
No.
Well, you know, the amazing thing is so many people see what you do and they don't relate because
No.
the doctor never told them to do that.
Well, this is the top of the line. The doctors are not aware of the top of the line service. Listen, the neurologists don't treat this stuff. Okay,
Right.
pain. They diagnose nerve injuries, and they're very good at it. The physical therapists don't treat this stuff. They don't know how to make a diagnosis. The chiropractors don't. They don't know how to make a diagnosis. Where is the pain? They can't do it. I know that because I see people that go to chiropractors. They come in my office all the time, right and left. You know, so what I'm telling you is, as a medical doctor, is based on knowledge and experience and projection. So we have to, know how the things are going to work out. Anyway. So orthopedic surgeons don't do this kind of work either because they do surgery. So who does the work for them? The physical therapist,
Right.
which is dropping your care. Don't ever
Right.
do that, people.
No.
Don't do it.
I agree 100%.
Yeah. And then who else is left?
Well, you've got
And
the
there's-
orthopedic surgeons. You
Well-
got the rehab people that don't really rehab because
Well,
before I met you.
I just mentioned that.
And we have the chiropractors.
I just mentioned that.
So let me ask you a question.
Who are you listening to? I've
was-
been talking about this.
I know, but I have earphones on.
He's repeating what you're saying.
So no, I want people.
And then put a shot in his ears.
Hey, look, when you get old, I might need a shot. in the
All
head.
right.
So let me ask you.
That's his new headset.
Okay.
It's working well.
Well, essentially, there isn't anybody who treats musculoskeletal problems
Right.
except my office. We actually treat this,
Right.
physically treat it.
Oh, I know that.
And there's nobody in the office except the doctors.
So let me ask you a question, which is always plaguing me, and this has been on TV. It was a show that was dedicated, which was called BS, and we know what BS means. In my 70-some-odd years on this planet, how could cracking your neck be healthy?
Can't.
I'm just doesn't that I mean, or cracking your back? It's not supposed to be cracked.
Well, that's worse than that. There's 7 bones in there,
Okay.
in your neck.
Okay.
They're all connected by ligaments. Okay. So, do you ever crack your knuckles like that?
Uh-huh, yeah.
Okay. That's what that's what they're actually doing to your neck. Now, in between all that is a spinal cord,
Ooh.
and I personally would not want my neck cracked.
No.
Having that so close to my spinal cord. I mean, but that's just me. I mean,
But people say that when you crack the neck, that it relieves pain. That isn't true either.
it is not true because if you understand how the ligament, which is a bone-to-bone connector, the properties of it, if it's painful and you stretch it, it will reduce its pain overnight and then go right back to pain again.
The next day.
Worse. And then it's all inflammation due to injury, and it'll start to lay down bone as a repair process. So now you have a spur. But it's in the ligament. That only tells you it's an old pain. That's all it does.
Okay.
It doesn't tell you where the current pain is. You have to know how to diagnose that. We spend a lot of time doing this. In fact, we research this stuff all the time. And the last bit of research I did at the medical school where we had a cadaver there, and I looked and see where the migraine headaches came from.
Oh, right.
And then we dissected that with the professor there, who spent 2 hours with me. That was really great.
No,
But
it's great.
But what we developed from that is a whole treatment program for migraine, which actually works, and it works right in front of your eyes. Remember that?
Oh, I've seen it twice.
Do it all the time.
2 different people. It's
Yeah.
amazing. Well,
Now the lady came back that you were there for her.
right.
She came back. Her migraine wasn't there anymore. It cured that one day,
I know.
one shot.
Well, the
cured
boy
it.
didn't
But she
do so.
had other things,
Oh, okay.
other reasons for headache.
You didn't
which
tell
were-
me this.
Which were which were unrelated
Right.
to the first one, unless they were related by injury.
Right.
Could have been injury.
Uh-huh.
Anyway, so now we had a treatment in the secondary places, so they're very happy. I mean, the husband is ecstatic.
Well, I'll tell you.
I can
He got his
imagine.
wife- he got his wife back.
Well, when a wife says she has a headache, we know what happens. But, so you got to be careful.
Sometimes they actually do.
Yeah. Well, I think the thing that really made me, like, I was almost in tears, but, being a macho guy, like I think I am, when I saw a 28-year-old boy who the mother had been taken to every doctor for his migraines, and he came in with a migraine because the medications weren't working. And Freddie, this kid was cured with 1 shot.
I
Or
hear
was
you,
it
but
2
he's not a
shots?
28-year-old boy. He's a 28-year-old man.
Well, it's yes, you're right. He's a 28-year-old man, but you know what? 28 years suffering. Well, I should say 28. Well, yeah, he was actually a little old. He was like 30, but he suffered for all those years, going to the doctors, giving him shots.
Well, that's the part of
Why?
That's
Why?
part of medicine that didn't progress.
Yes.
They've been doing the same thing for 50 years. I mean, when I went to medical school, they was preaching the same stuff,
Yeah.
and I didn't like it then. I thought it was crazy then, and it's crazy today. Migraine does not come from the air. It comes from a source.
Right.
And we figured out where that is. That's why we could treat it directly. People should be running in my office like crazy to get their headaches
Look,
out of
if
the
Well,
you
way.
I got a new
I
one.
mean,
I
this
have
is a sure thing, people.
I mean,
I'm not
migraines.
kidding.
I mean, I've seen what migraines do to people.
Yeah.
We run into a company that sells a pill that says, and we just heard it, and it says that it reduces the inflammation in the body throughout, so that the body could heal itself. Now, these are new words. Since I've met you, people have approached AMP and talked about it. I got a lot of shows that we turned away because they talk about reducing the inflammation completely from the body
Oh, we don't
with a
think
pill. I mean, please. Are you
That's
kidding me?
aspirin. Am I right, Doc? Is that aspirin?
Aspirin's your best drug.
No, this is a pill. It's about yay big, which is about an inch, and it reduces the total inflammation of the body. It doesn't make any sense.
the only one that's legitimate is prednisone.
Yeah, that's
And
the one.
then you have to be careful with that.
Ooh.
So all of this other stuff, you have to know what's in those pills, and I'm sure it's not right. I mean,
But everybody's jumping on let's remove the inflammation to heal the body.
inflammation, yeah, but inflammation is only segmental.
There you go. And there is the difference, Doc.
There is a difference.
Everybody says, take this pill, you have no more inflammation. Isn't true. It's not true.
Well,
Is that the same guy that says if you take this pill, you lose weight? Folks, we got to take a break. We will be back in 3 minutes. This is the Dr. Pinozzo Health and Medicine Hour and Sports. Whatever you have on your mind with pain, call up Dr. Pinozzo.
call in.
877-927-6969, and we'll be right back.
Have you ever had a business idea that you thought would be a great solution to tough challenges in today's world but have no idea of how to get started? You don't want to waste investment money on ideas that just don't work. Introducing Health and Wealth Seminars, a sophisticated advertising agency with over 40 years in the ad business. What makes Health and Wealth different from other agencies is that they fit your product into the public's need. They help put together the strategy of your business before you commit thousands of dollars just to find out that those ideas don't work. Health and Wealth Seminars carries advertising contracts, radio and television contracts, and even a production service contract that'll cover all of your business needs. Call today, 954-303-9563, and let Health and Wealth Seminars carry your business to the next level. The number is 954-303-9563. And remember that what happens when you don't advertise is nothing. 954-303-9563 is the number you need to get your business started in the right direction. Dr. Pinozzo is a world leader in helping those who have tried everything to get rid of pain in the body. When surgery or pain medicines aren't working, Dr. Pinozzo is here to help. Range of motion increased over 65,000 patients that Dr. Pinozzo has helped. And now he's here to help you. Call the show now, 1-877-927-6969, and let him help you get on the road to pain-free health.
Okay, we're back. And, Doc and I were talking this morning. Doc, talk to me about autism, what you've discovered.
Well, I think autism is it's not based on anything.
Okay.
It's an opinion of the examiner. Essentially, that's what it is.
Mm-hmm.
If you go to the websites of Autism
Speaks?
I'm on there, and I'm trying to find out what are the criteria for a diagnosis. There isn't any.
Really?
It's an opinion of the examiner. You understand?
Oh.
If my opinion is there is no such thing, I can never diagnose autism.
Huh.
Because that's my opinion.
Right.
There's no science to that.
Okay.
And it's taken over a big part of children's lives. I mean, everybody's got autism. Are you kidding me? That can't happen. There is no brain dysfunction. There is no psychological dysfunction. There is no physical dysfunction. This is all made up. Read the website. See if I'm wrong. I'm not wrong.
So where do you think it comes from?
See, I make a living on diagnosis.
Oh, I know that.
Okay, I make a very good living if I can diagnose something.
Right.
If I can't diagnose it, you're not going to come to see me.
Correct.
Okay, so I'm trying to find out what I can do to diagnose autism.
So you can help these children.
And there is nothing to do. So I went off on my own, and I did a research. It's
Right.
33 autism kids that had a legitimate diagnosis, as far as that goes, legitimate. Anyway, they all had headache.
Right.
And I said, well, who examined the neck? Nobody. They got a psychologist or a psychiatrist, and that's why they lose the diagnosis. So a couple weeks ago, we talked about birth injuries because autism shows up at 2 years old, which is you can't turn your head, you can't look people in the eye, so to speak, and they think that's so bad. Well, if you can't turn your head, you can't see anybody and look in their eye.
So it's a neck problem.
But if they're turning their whole body, they're actually hearing.
Mm-hmm.
So now you got to look at why can't that neck turn? Well, the neck is injured. That's why. And these kids have headache. So that was true on the 33 I saw. Now, one of them I think is going to come back. He's 10 years old now.
Oh, wow.
And I said, what's happened to him since? Well, they don't, there's no treatment for it. They put you in with a physical therapist who, I don't know what they do. I mean, if they don't know there's a headache there, how the hell do they treat this?
Yeah, I'm wondering, why does a physical therapist do? You're right for that.
Well, because there's no one else to dump it to. That's why. This is what happens all over the place. When you have a problem with a person in mobility or pain or something, they dump you right over to the physical therapist. The doctors are abrogating their right to diagnose.
Wow.
That's a strong statement, and it's true.
I mean, you say a statement, it's always true, or else you wouldn't say it. And if anyone wants to challenge you, they have the right to challenge you.
Challenge me all you want.
Yeah. Okay. So,
in fact, I love a good argument.
Yes, I know you do. I know you do. And it makes you feel good when you can help somebody.
Well, that's the whole idea, and you can't do it without a good science base to your practice. I mean, what are you doing? Giving Oxycontin is not the way to practice medicine. You don't do that. No,
right.
You never do that.
That's a narcotic.
You diagnose where the pain is, and you treat it directly, and you expect the result right then and there, and we do. Within 2 minutes. I mean, somebody listening out there say this guy's got to be full of crap. No, I'm not. This is the way it works.
Do I have somebody on the line? Okay, sorry. So I had someone.
Well, the funny thing is that people will call and say, I had an operation, I've been taking medication now for 3 years, and I'm in more pain than I started with the operation.
Yeah.
Right.
So why do you keep doing that?
I don't know. There are people who have their knees operated 4 or 5 times. You say, why did you do that? I mean, this is just ligament stuff. It's scar tissue. You can only have your knee removed once. You know, it's not in there anymore. So what are you treating, actually?
And if you don't believe us, folks, go to JAMA, at www.JAMA, which is the Journal of American Medical Association. They say almost half of the people that go in for knee surgery should have gone.
Shouldn't have gone.
Well, it was worse a few years ago. They had other studies that meniscus should never be operated.
Right.
You're causing a lot of scar tissue, which 10 years later you got a lot of pain with it.
Mm-hmm.
And now they want to take the rest of the knee off. And I remember we did this last week. I don't know if you remember, Les. We measured my knee with 16 inches around.
Yes.
The actual bad part of that knee is only about 4 inches. In other words, a fourth. They're throwing away a perfectly good knee for a fourth of a ligament.
Wow.
That's all. When you get right down to it, find out exactly what they're doing, you know it should not be done. And how much money would Medicare save if they would not approve any of these knee injuries?
Well, and that
no
saving
idea.
comes down to everybody.
Yeah, it filters down to
Yeah,
everybody
filters
after they
down.
make a determination like that. But
Well, I think we have somebody on the line that wants to talk. Hello? Hello?
Why do we have less working the phones?
No, I'm watching. It's they were there, but then they hung up.
Could be a cell phone.
Okay.
877-927-6969 is the number.
Okay.
Call in. Let us hear about what you got going.
Okay. Now, for all of you people who don't want to call in, you can always reach Dr. Pinoza. I know you're saying he will answer the phone at 561-381-5800. Now, let me just say, I don't know any doctor would answer the phone and talk to you. Dr. Pinoza cares enough to find out if he can help you.
one lady said to me, or said to a friend of hers, who said to me, if the doctor answers the phone, what kind of office is that? I mean, like it's bad? I mean, how often do you get to talk to the boss? I mean, you know, it's that is a favor I do to people.
No, I think it's
There's-
fantastic.
There's no downside to it. It's
No.
all up. I get to talk to you. You get to hear me. We get to discuss your problem. And if you have to come in right away, I'll work extra and bring you in. Otherwise, we'll have you wait. But that is a privilege that I give to people. That
No,
is
I think
not
it's fantastic.
That's not to say what kind of office is that. You don't have a secretary. I could have 100 secretaries if I want them. I don't. That's the way I run my office.
Well, let me tell you something. You ever try to call a doctor? Hi, you've reached the office. Okay, can I speak to Dr. So-and-so? Oh, he's in surgery. He'll call you back.
No, first
They
they go,
never call you
no,
back.
No. First they go, hold on. So
Hold
you go
on,
home
I'm
for
sorry.
15 minutes. They come back. Then he's in surgery.
Yeah.
Then
I don't want to talk
take
to
a
them.
message.
Okay.
Or let me help you, or can somebody else help you? No, none of that.
Have you ever had a surgery and then you can never get rid of your doctor? You can never find your doctor until you have to come back the next time?
That's right.
Well, I think it's disrespectful
Sure.
of the physician not to take a call.
I agree.
I mean, the person wants to get treated by him. So why would you not want to take the call? I mean, it doesn't make any sense to do anything else.
But what else amazes me about you is you take the x-ray, you look at the x-ray, you discuss it with the patient, you do the C-arm, which to me is phenomenal. So you know exactly where everything is. You don't have to rely on someone else, sending them down to the x-ray technician or the other guy coming up and saying, here it is, Dr. Pinoza, and you're looking. I think that's the way medicine, you practice medicine the way it was done in the old days with new technology. That's what I say.
Well, you also have a trust factor.
Yeah.
If you're looking at my x-rays and explaining to me what's going on, I'm more comfortable.
Sure.
If somebody else is doing it and they hand the ball off to you, I was in sports. The exchange is very important.
That's exactly
and if
right,
that information gets diluted, I'm in trouble.
Sure, they sue you.
No, what happens is he's going to listen to somebody else who's going to tell him what their opinion is.
Right.
And I'm not going to get better.
No. Well, it happened to you.
It did happen to me for years. And it happened to a lot of people that have called.
And what happens is people get skeptical because they're saying to themselves, how could he do that? Well, guess what?
Nobody else does it.
He's a real doctor, folks. Ed D., Ohio State University.
Yeah,
he's been around the block a couple of times.
Just because the orthopedic surgeon doesn't do it doesn't mean anything.
No.
He does things I don't do, which is surgery.
Talk to me about MRIs. What is it? What does an MRI show?
Well, I don't really like them.
I know you. That's why I
And
wanted
the
to ask you
reason-
why.
And the reason is that the general doctor orders them because he doesn't know how to diagnose a pain.
Okay.
So he thinks, well, the MRI is going to show me what's inside there, and that'll make a diagnosis. All right. So the guy who doesn't know anything about back pain orders the MRI. The guy who reads it doesn't treat this kind of thing.
That's right.
Okay, so what he's reading is that a value? Maybe, maybe not. They're reading every level there is, L1, 2, L2, 3, L3, 4, L4. And you say, well, which one of these is doing it? They don't know because they don't treat that and they can't diagnose it. So now you have a general thing which says you have a bulging disc here and a bulging disc there. And you think that's significant? That is not significant.
No.
It is only because of the way you're laying down to take the film. So if you're crooked this way or crooked that way, it'll be bulge here or bulge there.
Sounds logical.
The annular ligament, which they call the disc, is not the disc. The disc is inside. The ligament is what bulges, and they don't read that. And then it'll read which side it's on.
Mm-hmm.
So you say, well, what good is this thing? We don't even know what they're talking about. And they don't either. They're just reading it. They don't understand the significance down the line of what these things mean. Okay, so, but I do. And we do a special film that no one else in the world does.
Oh, I know.
Just us. We develop these things.
You designed it.
We designed it and developed it so that we get an accurate read there. And, of course, we know what the pain pattern is, and we have a clinical exam. So all the baseline is there in my office.
Right.
And none of it is there for the MRI. You got it?
Oh, I understand perfectly.
So we don't order. We don't ask for them. We do better with what we have.
Because what you have shows you where the pain is.
We already know where the pain is.
And you could go right to that
and then
pain area.
We take the film to see that area.
Mm-hmm.
We don't take the film to diagnose where the area is. We already know it by history and clinical exam and other things that we need to do.
Amazing.
So that's the way it's supposed to work.
Yeah.
When I was a first-year medical student, before automobiles.
So you helped Henry Ford, right? Because he had a pain from jacking up the car. No, I understand.
We had a really good professor of medicine, and his first day he said, X-rays are wonderful things, and they are to help you diagnose, but not to make a diagnosis.
Really?
And I remember that all these years, and that's the way I practiced. I had a very good school at Ohio State.
It's a great school.
You can't believe how good that school was.
Oh, Ohio State is a great school.
And it was right there where the money is in Columbus, you know. So,
so I always asked you, baby, what made you go into this field? I mean, I think you and your son are the only ones that are musculoskeletal experts.
Well, we like the idea of the construct, cause and effect, the usage of anatomy, the physiology,
correct,
and the failure of that to bear weight. So if you understand physics and you understand how the body works, then you could diagnose the failure of that body to work. Mm-hmm. Now I've given you all the secrets. I mean, the pain is not a pain. The pain is an inability to stretch. So you have to know where that is. And it's also an electrical phenomenon. Mm-hmm. It's not imagined. You cannot imagine pain because it's an electrical phenomenon.
Wow.
Okay? So when somebody says, I remember that pain, you don't remember that pain. You think you remember that pain.
Right.
But to actually remember that pain, you can't do until that electrical impulse hits your brain and tells you this is where it hurts.
Right.
So these are all the things that go on in my mind. Now, I mean, I had a guy in there who was really jumpy and just a couple of days ago.
And you're always researching.
And I'm taking a history, and he said, well, what's wrong with me? What's wrong with me? I said, wait a minute. I mean, you have to watch this evolve. It goes from the question.
I'm sorry?
Christine.
Christine's on the phone for Dr. Pinozzo. Hey, Christine, how you doing? Hi, Christine. Well, she might be on the phone, but she's not listening. Hey, Christine. Hi, Christine.
Hi.
Hi, you're on the phone with Dr. Pinozzo. What's the problem?
Okay, I'm actually calling for my daughter. She tried to call the show 2 times and couldn't get not through. She said Lee answered, and she heard all kinds of noise, static, blah, blah, blah. So I'm calling. She has cervical spondylosis between the C5 and C6 and between C6 and C7. And she gets pain in her neck and shoulders and her upper back and her upper right arm. And she gets periodic numbness in her right hand and deep aches in her collarbone. And they said eventually they're going to have to do surgery, which she's afraid to do because she's afraid she might become paralyzed.
She shouldn't be afraid of that. That rarely happens. But it is treatable now. So,
through you?
Yeah. If we have the techniques to do that. And what she's saying is correct. It does go to the upper arm and between the shoulder blades. It does do that. So, yeah, we could treat that. We treat it every day of the week.
And now you work, is it Monday through Fridays your hours?
Yeah, 9 to 2.
Well, what I can do now, since you are having a problem with your daughter, his number, if you want to make an appointment, is 561-381.
Yeah, I have that number.
Oh, okay.
Yeah, I have that number. Yeah, I have it from when I listened to your show once before, because I also
great.
said, if anything ever happened to me, I would definitely go see you, even though I'm not near you. Now, she lives in North Carolina, and I'm wondering if it's worth her to come here to see you.
Absolutely.
Eventually.
Well,
Oh, okay.
I'm a patient, and I'm not the doctor. I'm Freddie, and I could not walk on my left leg when I met Dr. Pinozo, and I'm working again. So if I'm in New York, I would fly down. North Carolina, I would fly down. It definitely will change your life.
how about some of that food out from England?
Yeah, somebody came from England.
England,
Took care of
yeah.
her.
Yeah, it's definitely worthwhile to come down, at least get an opinion and get a treatment. We do it all in one day. I mean, we do it in the first half hour I see, we'll have that pain down already. And once it leaves, it's not coming back. See, so it's worth it to do that.
You'll be amazed.
Okay.
Thank
All
you.
right. Well, thank you very much.
Well, thank you for calling. Appreciate it.
Okay. Bye-bye.
Bye-bye.
Now, I wanted to touch on, it's NFL season. NFL started. First three games were played this past week. The number of kids trying to make teams is tremendous. Okay, I'm a Jet. I should follow the Jets. They just throw their bodies around because they want to make the team. So they are just running like through a big wall. So when they get hurt, we're waiting for the MRIs. And I'm hearing your explanation about MRIs. That's what they rely on.
I know, it's a real tragedy.
It's a shame.
They started doing that years ago, and I just withheld judgment until I finally absolutely knew what caused the pain, where the pain would be sourced from. That tells you that the MRIs are not that good. They're just red in general. I mean, but that's not the worst part. The worst part is who examines these players before they go out in the field.
Well, they have a medical department.
No, they have a trainer.
And they have a trainer. And no, they bring in a doctor.
Who?
So what they do is the trainer does the deal, gives it to the doctor, he tells them what he sees, and then that's the way they go.
Orthopedic guys.
They're all orthopedic guys.
Dr. Parks
In other words,
from California.
Okay, that's what I said. There's nobody in these organizations that actually do this kind of work, musculoskeletal work.
No.
Surgeons don't do this work.
No.
They do surgery.
Right.
That is a big difference. And who does this work? The trainers.
Amazing.
And they're not qualified to do it.
I would take the kids that are trying to make the team, right? Take Dr. Pinozo, bring them to camp.
We'll have
And
to
say,
see
come
that.
here, let me see you. Set up a triage right there. 1, 2, 3. Get them done. Of course, we have to bring in the machine and all that, but this is the NFL. You know what I'm saying? This ain't a fly-by-night organization.
You know what? To me, if I was an owner of a team and I was able to get my $20 million guy on the field, I would say, you know what do I got to lose? Let me see this guy. I mean...
Woody, give me the last play on the Jet. Give me player 126. Let me fix him up.
The owners of these teams know how to make money. That's how
but
they
they
can.
They make a lot of money.
But they don't. They know how to make money. That's how they bought the team. But
Yeah.
they do not know the practice of medicine.
No.
And they're hiring a well-known surgeon. How does a surgeon make their living?
I love that.
By operating. And how many of these people go back to playing? Very few.
And if they are, they're out for a year rehabbing.
We saw a couple of players.
Yes.
That, what was their names?
Cleveland Gary?
Okay, there are two FL that we treated.
And Troy Stratford.
They both would have played longer had they come to me first.
What did Cleveland say to you? I'll tell you what he said because I remember. He said, Doc, if I would have seen you a year ago, I would have been able to play and I would have bought you a Ferrari.
Yeah, that's what he
And
said.
that's from the. And I spoke to Cleveland. He said, "Oh yeah, it's true. It's true."
Yeah.
Troy Stratford was one of the #1 draft pick out of I think Boston College. Am I right, Freddie?
Yes.
And he played for the Dolphins. And he went to Dr. Pinozo. He walked straight. He has no more pain.
It's after they retired, though.
Yeah.
They want
But
to
I
come
got a
in there
question
before
for
they
you.
retired.
Yeah, it's amazing.
I
Amazing.
got a question about
By the way, if
hamstrings.
any NFL player comes in there, they have to bring a Ferrari first.
Yeah, bring the Ferrari in first because we don't want to wait for any things.
And they can afford it.
But that's the superstar. I want the last player on the team because they're not going to give us the superstar.
Did you just get a tweet from somebody?
Yeah, I got
Okay,
a question
go ahead,
about hamstrings.
Go ahead.
The guy has hamstring issues. Is there anything that can be done with what you do for his hamstrings?
Well, I don't know what did you mean issues?
They said torn hamstrings, tear, rips.
Well, first of all, you don't get any tear of anything.
That's what I was alluding
If
to.
you get a muscle pulling out of the bone, you have to have blood.
Okay.
Okay? You have to have a blood clot. You got to be able to see it. Otherwise, it didn't happen. So now you have a strain, which is lesser, or you have a referred pain from the lower back
Into the hamstring.
into the hamstring.
So let's assume that we have a strain in the hamstring. Let's start with that one, which is 50-50. But let's say that we have that in a football player. Now he's out for 4 to 5 weeks because of that hammy.
Well, that is really stupid. You should never be out
That's my point.
more than an hour. I mean,
Really?
That's what it takes to treat this stuff.
So it's really the inflammation on
Yeah,
the
if you
hamstring?
know how to do it, you can treat this and they go right back to playing.
Okay, now question number 2. It's a lower back creating the pain towards the hamstring, which may take longer than 5 weeks.
No. Takes,
In the real world, I'm saying in the world that they know.
oh, in that world they know. Oh, well, who knows? But in my office, it's 10 minutes.
So if I have bad hamstrings, torn, ripped, whatever it is,
Yeah.
and I come and see you, there's chances that you can repair a bad hammy.
Yes, absolutely.
In the NFL right now, 40% of the kids have bad hammies, and they're sitting on the shelf.
Well, it's too bad. Somebody's wasting a lot of money.
Now, can they go back and play the next day? Can they go back to
Yeah.
working out and all that?
If we fix them, they
It's
go
just
back
amazing.
playing.
Yeah, it's amazing. Well, here, let's go back. Paula, who's a tennis pro, she wrote in on one of our websites and said she teaches tennis to older players and believes that Dr. Pinoza can help with her clients to get more mobility. She wants to set up a program that would help her clients with your services and her techniques. In other words, she wants to set up something with you so you could take care of those patients.
This is similar to the golf school we're promoting.
Yeah, this is a smart lady. She wants to help.
Yeah, this tennis swing is
it's a
similar
tennis,
to the
Yeah, tennis. You said tennis.
tennis is similar to golf
Right, right.
and baseball. They're all
Yeah.
the same. You're using the same anatomy to do
Right.
all those.
So, Paul, let me give you Dr. Pinozo's cell number so you can give him a call. It's 561-381-5800. I mean, that's a smart person.
That's a very smart person because she sees that she's going to benefit if
Sure.
she has a good client to work with. She can show what she knows.
Yeah.
Otherwise, she's stuck. I mean, what is she supposed to do? The NFL people ought to understand the same thing. They are stuck with the anatomy that their player has. Not to change it, but to treat it, get it out of the way,
And if-
then they can do better.
And the funny thing is that her percentage of success is getting the ball over the net.
Oh, yeah?
You understand? That happens every time you don't. You're in a lot of trouble. So she is
Yeah.
smart. That's an intelligent person.
Yeah, it is. And there's Mimi from Miami. I'm trying to get all these in because we get stuck on getting all the questions. Mimi from Miami says, how young will you see children? My son is 6 and has back pain. Wow. Due to a fall when he was 5. Doctors say it will heal in time, but seems to be getting worse.
It does not heal in time. Whoever is giving this advice, it's bad advice.
He could get scoliosis from that.
Well, that's what it is.
Yeah.
That's what he's
That's
getting.
the beginning.
Yeah, beginning of scoliosis. As you said, scoliosis, you're not born with scoliosis. It's not inherited.
No, it's all due to trauma, due to falls, and this is a good example
Yeah.
of it. I mean, the pediatricians really ought to wise up. They're too close to the orthopedic surgeon. See, if there's no operations to do,
No.
what do?
Can't make money.
Well, it's not the money; it's their expertise.
Doc can't
they
say
have
that.
to.
No,
Doc
it
can't
isn't.
say that.
It
No, I
isn't
can't. You
anyway.
can, but we
Doc
can't.
can.
Doc
We
can,
can.
but we can.
It
can.
isn't. It isn't anyway. They don't share fees. Don't tell people that. That is not true.
Right. No.
It's expertise. You have to go out of your
Comfort zone.
comfort zone. Learn new things. That's what I do, and that's what everybody should do.
Doc, I used to take my son to a world leader in New York City. He used to say $250 before he said his name. Sorry. It's a true story. It's a true story.
Well, I mean, there are people like
He
that.
was good, but man, he was expensive.
Oh, wait, here's a great call, Fred. Here's a great one right here. Alan from Boca says, I saw your show with the coach that called in to have kids checked by your office before playing. Can you prevent future injuries by finding areas missed by the regular doctors? Injuries parents may not know about.
You can't. Well, the question is disjointed.
Yeah, well, we don't make them up. They send them that way.
Les. Please. Now, here's how you have to look at this. As far as preventing injuries, you can't prevent injuries.
Right.
There's no way to do it because you can't surmise all the situations.
Sure.
But you can treat any injury that you get if you know how. And sitting on a bench is not going to do it.
That's not going to do it.
No.
That's right, and that's what the NFL does.
If you're going to be a working physician, you want to be active. You want to be able to diagnose and treat. That's what we do.
Right.
I mean, having people sit on a bench is not going to help you. Having a kid not play is not going to help.
Yeah, but that kid is one kid a day. You got 40 people you can see. You're going to move them quickly.
Well, I mean, we wouldn't. We would go give them their clinical exam for their sport, and we don't have to charge them for that. But it's very fast and very efficiently done.
Well, here's a golf question. I'm sorry, Freddie. You want to say?
No. Well, the amazing thing is the doc will go one by one through everybody. So if you got 40 kids, he's going to see 40 kids.
And he'll diagnose those 40 kids and tell them what's wrong.
Yeah, and he's not going to be putting them on the bench.
We could do them 10 at a time.
Yeah.
You know how to do that. Military kind of exam. I was a captain in the Air Force, you know.
Oh, you haven't told me that. My God.
We had to examine all these people, and you learn how to do it efficiently, you know.
Well, here's one. We talked about the golf swing. Mark from Boca said, my golf swing isn't what it used to be, but I have no pain. Do I have to swing harder, or is my age catching up with me?
You have to swing harder.
Okay. So,
see, a lot of people continue to do the wrong thing over and over again.
Oh. Well, the problem is people don't realize that, and I'm realizing it. It's the art of golf should be taught by the instructor, but they don't understand the physiology of the golf swing, so they try to give you a new way to swing.
It's not in their curriculum, and
right.
That's the problem with the PGA up there where they are up north. They should put that in the curriculum. They're really fooling the public. I think they ought to be called to task on that.
Well, you're going to do that.
They don't know the anatomy and the physiology that produces a swing. They don't. And they're depending on machines to do it.
Doc, Tiger Woods is having another injury, same injury over and over again. If the top of the class of a guy who can afford the best doctors in the world is doing the same thing over and over again, what do you think the rest of us people are going to be doing?
Well, that's true. Whenever anybody gets an exotic surgery, thousands of people in the country get the same thing.
Yeah, they run to the same thing. The NFL's the same way.
I mean, it's just a real shame. It's a real shame.
Because here was one of the greatest golfers that, to me, Tiger Woods was one of the greatest golfers that ever lived.
But you know what? He will do it again if he gets all that pain out of the way and gets that swing. Throw all those instructors away, get the pain out of the way so his swing is normal. He has a good brain, good eyesight, and he's going to come back. But he can't do it because he can't do it. And I've been predicting this a long time.
Yeah, you were telling me by watching it. You told this to me before I had the surgery, but watching the way his leg was going.
I was watching him walk, and he had a medial hip pain.
Well, when you go to people walking, I remember a person that came in. She said that she had ankle pain. She was going to the podiatrist. You said, no, you don't. And she said, what do you mean? She said, no, you don't have ankle pain.
True.
You diagnosed her, and she got a shot, and that's the way that keeps talking about you.
Good old Leah.
Leah is the best. She keeps saying, my God, I don't have to wear that stupid boot. And she said to me, Wes, you know how bad it is when I have to go to the beach wearing that boot?
Hey, Doc, I just got a tweet. It says, do a commercial for Tiger Woods. Say, Tiger, this is for you. No, and do your explanation on a commercial.
No, we can't do that.
Can't do that. But I'd like to say, though...
But I've already done it. I've said you got to get all the pain out of the way and then go back to a normal swing. And with his eyesight and his calculation in his brain, he's still a top player. He's got an impediment right now. So this could be fixed. I mean, that's for you, Tiger.
So if anyone out there really knows Tiger and is listening to the show, it behooves you to at least give Dr. Pinozzo a call. And I think he lives in Jupiter, right?
Yeah.
Yeah, so he's not that far away from...
He's not. Yeah, but I'm a little upset because last week we got some phone calls that didn't come see the doc. So obviously you're walking around with pain, firefighters, police officers, doesn't make sense.
Well, that ACL one.
That was really...
I mean, I really expected her to come in.
So did I.
Look it up on your computer, ACL. Just plug in ACL, enter, and you'll see all the stuff. Wikipedia, There is no diagnosis in there. The ligament is only that long. How in the hell could it do all this trouble to you? It can't. I'm still convinced. I was talking to my son the other day about this, who's a physician in Phoenix, and I said, I really don't see how this works. Physiologically, I can't understand it. And if I can't understand it, how could it be there? I mean, I know the anatomy. And he reluctantly agreed. I mean, it's just, most of the damage occurs on the front of the bone structure, which is a ligament.
Right.
Inside of that, 2 inches away, is the ACL. How do you get that without going through the front first? You can't. So you have to fillet the knee to get to it.
So
I mean, it's just impossible to understand.
So you could fix that without going in for surgery. That's the beauty
Even
of that.
if you could sprain that, it's still injectable. You could take the pain right out. There is no pain on the inside of the knee. Where do they get this pain at? It's all on the outside of the knee. Right. I think it's a big scam. The whole thing, ACL, is a big scam.
Anybody who has an AC injury,
ACL
injury, I want them to visit Dr. Penoso this week. Anybody.
If
you got an ACL injury, come on down. We want to take pictures and film.
We can't handle 25,000
I want 25,000 people there. 25,000 people. That's what I want.
Let's do it with 250 to start with.
No, let's deal with, bring it on. I want to see this ACL phenomenon.
We're making a challenge to everyone out there who has ACL problems. Call 561-381-5800, and Dr. Penoso will actually answer the phone and talk to you about it.
And I'm going to film it and show the world.
Well, right now
film it and show the world.
Okay.
We get calls and tweets from all over the world about this, and we can only give you the information, folks. We can't. It's that old saying, Doc. You can lead a horse to water, but you can't make it drink it. I mean.
Yeah. Remember, the decision you make as a patient will affect your life from there on in.
That's exactly right.
So you want to do the least possible thing first. You can always do severe stuff later.
Yeah.
But do the least you can do to beginning. Get a diagnosis properly. Now, I'm putting a doubt in your mind. Take advantage of it.
Yeah. Well, I can see, again, this thing goes so fast. We want to thank everybody for listening. And if you want to talk to Dr. Penoso direct, call him at 561-381-5800. We'll see you next Sunday. Have a great weekend, everybody. Bye, Freddie.
Bye-bye.
This has been the Dr. Penoso Sports and Medicine Hour with Dr. Anthony Penoso. If you spend 5 minutes with Dr. Penoso, you'll see he genuinely enjoys helping others. Visit Dr. Penoso online at www.paincentersnationwide.com or call him at 561-381-5800. Dr. Penoso will consult with you to determine the best solution to your pain needs. 561-381-5800 is the number to call, even if it's just for a second opinion. Join Dr. Penoso next week when he brings you more important information on the physics of weight-bearing and engineer concepts for the body.